Hello, learners. Today we are going to talk about writing forensic reports. As we know, clinical psychology reports and forensic psychology reports serve very different purposes and are used in different contexts within the field of psychology. So, we're going to understand the distinction between the two with regard to purpose, content, audience, and implications. So, first, let's talk about clinical psychology reports, and then we'll flip over to forensic reports. The purpose behind a clinical psychology report is primarily used to assess, diagnose, and treat individuals within the therapeutic context. These reports focus on understanding a person's mental health issues, developing treatment plans, and tracking progress over time. Several sections that we may see within a clinical psychology report might be background information, including one's personal history, presenting problems, and reasons for the assessment. Next might be assessment methods used. So, this would describe the tools and the methods used for the evaluation, such as clinical interviews, psychological testing, and observational data. Then we would report our findings, which this would be providing an analysis of the data that was gathered, including any diagnostic impressions based on the DSM 5 TR, is what we're using right now. Diagnosis, so any specific mental health disorders or conditions identified. Treatment and recommendations, suggesting treatment options, including therapy and any other interventions. Prognosis, this offers an outlook on the likely course of the individual's condition and response to treatment. And then lastly, we're just going to be emphasizing the confidential nature of the report. And for the audience with regard to the clinical report, this is primarily intended for the client, their therapist, or other healthcare providers involved in their treatment. Sometimes it could be shared with family members or significant others if appropriate. And the implications for a clinical report would be to focus on helping the individual improve their mental health and well being. And this report is used to guide treatment decisions and to monitor progress. As we move over to forensic reports, the purpose of these is used in legal context to address questions related to legal matters such as competency, criminal responsibility, risk assessment, and custody disputes. These reports often have implications for legal decisions and proceedings. The content within a forensic report is going to be somewhat similar, but it is also going to differ. So, we are also going to gather background information, but this may be providing context related to the legal issue, including any relevant personal history or details of the case. We're also going to report our assessment methods, and these may be similar, but they also may be different. They are also going to definitely include clinical interviews, psychological testing, but then here we may include a review of legal documentation, which would differ from the clinical report. Our findings are going to be related to the legal question at hand, such as mental state at the time of the offense, competency to stand trial, or risk of reoffense. Then we're going to offer our professional opinion related to the legal question and whether the individual was legally maybe sane at the time of the offense or whether they're fit to participate in their defense, whatever the legal question is. Then we might make our recommendations. So we could suggest actions or interventions based on the legal context. Perhaps that's treatment recommendations for mental health issues or specific conditions related to the legal proceedings. Next, we want to take into consideration the information pertinent to the legal context, such as standards for competency or criminal responsibility, and we may even reference legal statutes or case law. Lastly is disclosure, and this is very different than clinical reports. We need to emphasize that the report is intended for legal purposes and may be shared with the court, attorneys, or other legal professionals. Our audience for a forensic report is going to be judges, attorneys, or other legal professionals involved in the case, and the report could also be presented in court as evidence. Some implications focus on addressing the specific legal question at hand and guiding legal decisions. The report may influence sentencing, custody decisions, or other legal outcomes. So, in summary, the main differences between clinical reports and forensic reports are that clinical reports are going to be used in a therapeutic setting to aid with treatment, while forensic reports are going to be used in a legal setting to address that legal question. The focus of the content with regard to clinical reports is going to be diagnosis, treatment, and progress, whereas forensic reports are going to focus on legal implications, competency, or criminal responsibility. The audience for the clinical reports is going to be the client and their treatment team. For forensic reports, that's going to be legal professionals, and it could even be presented in the court. And with regard to implications, clinical reports are going to guide treatment decisions and therapeutic interventions, while forensic reports are going to influence legal decisions and proceedings. So both types of reports require very thorough assessment and analysis, but their purpose and impact are tailored to their specific content. So, one thing to keep in mind is that forensic reports contain no inferences or speculation that cannot be backed up by data or supported by research. Plausible implications that other psychologists might find reasonable may be quite different from explanations that will stand up in court as a line of defense. So, that's going to be one very big difference. So here, I just want to remind you of the 4 Bs: to be clear, be relevant, be informative, and be defensible. If you be all of these things, you're going to be all right. So we're going to cover each of these. To cite the source where much of today's information is going to come from, it is going to be Grisso 2010, Milton and colleagues 2006, Weiner 2006, and Witt 2010. We are going to talk about the what's, how-tos, and whys. So let's jump in. To write or not to write, that is the question. As forensic psychologists, we need to be cognizant and careful about what we write. We cannot be on autopilot. We need to be very thoughtful about everything that is included in the report because what you say can and likely will be used against you in court. Check with your client, who's going to be the attorney, as to whether that individual wants a written report. They may or may not. Remember, if you write it, you better be able to justify it. Use as much information as you can to show how you came to your conclusions. If you think back to our previous lectures, we talked about obtaining and reviewing records such as educational reports, like IEPs or 405 plans, past psychiatric hospitalizations, treatment notes, past involvement with the criminal justice system, perhaps financial records, and many more that you can always use to bolster your report. Similarly, don't forget about behavioral observations, especially if you've met with the defendant more than once. Their behavioral patterns, if they are similar each time or if they're very different each time you've seen them, can support your assertions. If you think back, we also discussed the importance of collateral sources. Maybe that is friends, family members, coworkers, past treatment providers, and whatever information they're going to share with you could potentially be very valuable in forming your opinions. And then lastly, use any type of psychological testing and research that you need to help you out. Similarly, if you write it, you better be willing to hear it read back to you in court. The forensic setting has the potential to be a very contentious place, and as such, you may be cross-examined and asked to defend yourself in depth. So let's talk about structuring your report. Structuring a forensic psychology report requires careful consideration of both the legal context and the psychological content. The goal is to provide a clear, comprehensive, and objective analysis that addresses the specific legal questions or issues at hand. We want to be coherent. Your report should have a nice flow to it that makes sense. Start with the referral question. Clearly state the specific legal questions or issues that prompted the evaluation. So perhaps that's competency to stand trial, criminal responsibility, risk assessment, whatever the question is. Then we want to move on to the referral source. Indicate who requested the evaluation. Maybe that was the court, the defense attorney, the prosecution, and any relevant background on why the evaluation was requested. Include what information you used to reason through your decision-making process and come to your conclusion. We want to move from the concrete to the abstract. We're going to keep the sections distinct. So, for example, observational data should be kept separate and apart from inferences. Similarly, when we're writing about past, present, and future functioning, it's also going to be important to keep these sections separated and clearly marked. The structure should be meaningful. Think about who might be reading your report. Perhaps it's the defense team, potentially the prosecution, maybe it's the trier of fact. So think about what's going to be useful for them to understand your defendant, their behavior, and any legal questions at hand. Remember, we have spent a lot of time getting to know the defendant, and not just through clinical interview, but getting to know them through records and collateral interviews. So use what you've learned and communicate it in your writing. Remember, you can break your report down using as many or as few sections as you need to be useful to the reader. As we've already mentioned, clearly articulate the forensic referral question. You will see this as we go through an example report next. The legal question may be repeated multiple times throughout the report to remind the reader of the purpose and explain why we are including specific information or using certain tests. We want to describe the methods, tools, and records used. In the methods/procedures section, we're going to include any assessment tools that we've used. So we want to detail the psychological test, the interviews, the other methods used during the evaluation. This may include standardized assessments, structured interviews, or behavioral observations. Often you're going to see that the report lists the various different tests that are used. Then each test may or may not be described as far as the name, who is it used for, specific age groups, what is it measuring, what edition of the test, and this is going to speak to how old it is, who is it normed on, and a bit about it. Was it an interview? Was it a self-report? Was it some type of hands-on, etc.? So remember, oftentimes your reader is not going to be a fellow psychologist who already has all of this knowledge of various different psychological assessment tools. So we might need to spend a bit of time explaining why we chose what we chose to use in our battery and why. Also, sources of information. We're going to list all of the sources that provided information to us. Maybe that was police reports, medical records, previous psychological evals, and then again, interviews with the individual and collateral sources like family members or even witnesses. Report data is going to be relevant to the question only. It can be very, very tempting to add every single piece of information that you've gathered, but we want to keep it tight and to the point of the referral question. There are going to be due process and self-incrimination issues that come to bear. That's why we want to keep it tight. Ask yourself if it is necessary to collect all the data that you might collect in a clinical evaluation, and often it's not. Always ask yourself, does this relate to the legal question at hand? So we just want to keep coming back to this question. We're going to break down a report next in the second part of this lecture, and I'm going to point out very specific language that we use within a forensic report that you often don't see in other types of reports, and we use this type of language to protect us. Remember, in a previous report, we talked at length about the difference between clinical and forensic reports, and you have to take your clinical hat off sometimes in order to do forensic evaluations. We don't want to leave out any relevant data just because it doesn't fit our hypotheses or your client's strategy. If the data doesn't fit, that is okay. We're still going to include it in the report. We don't leave it out because it doesn't fit. This does happen sometimes, and it's going to be okay. It's very important here that pieces of information that you get don't fit or don't make sense. But again, that doesn't mean that we exclude it. That would be unethical. We include it and we figure out how to explain it or talk about it with research or data, or just state that we can't make sense of this. Where possible, we want to use multiple sources of information. In the sample report we're going to look at here in part 2, this report contains at least 3 different tests of memory. So the more ways that you can prove your point, the better. Same with corroboration. When it comes to gathering information from sources, don't be afraid to ask pointed questions to confirm or refute what has already been shared with you, especially if your only source is the defendant. We want to remember to ask our collateral sources to get as much information to really paint a full picture of our defendant and what is going on with their behavior, their emotions, the legal question at hand. We want to remember that the stakes are going to be highest for our defendant, and they may want to paint themselves in a particular way to obtain a particular outcome. So that's why it's really important that we try and corroborate as much information as we possibly can. Again, we want to remember our audience is unlikely to be another psychologist. At times it might be, but for the most part, it's going to be a legal audience, lawyers, judges, etc. And they are not going to be familiar with the tests we often use. So add a little bit about each test within your report. For example, if the data was collected through a self-report measure, this is going to be important because self-report is exactly what it says. It is information coming directly from the defendant versus some type of psychological assessment tool that may be a little bit more objective. We want to avoid reporting raw data. This is not going to be helpful to the reader. We need to convert it to the scores that can be interpreted. You're going to see in the forensic report that we examine next that there's often a short paragraph in forensic reports that talk about scoring and descriptors. So the descriptors that go along with the score, such as below average, extremely low, average, etc. So the person can kind of have a better understanding rather than just looking at numbers and having no clue. Similarly, if someone invalidates a measure, we do not interpret that. If it is invalid, we can say what the measure is, a little bit about the validity scales, and report that the scores were invalid, and then we stop there. We do not give any more information. Always remember to follow the testing protocol and the administration guidelines. They're there for a reason. Use them to ensure that you can count on the results and that your evaluee can get a fair chance at having a unbiased assessment. This slide is important. As psychologists, we tend to use jargon, and it makes total sense in the psychology world, but it may seem like a foreign language to our readers. So we want to make sure that we use language that our reader and our audience can understand. So for example, whenever we're talking about mood, instead of saying dysphoric, which may be, again, a foreign word to a lot of our readers, instead we can say depressed mood. Instead of saying oriented 3 times, this may make no sense to some people, even though for psychologists it makes a lot of sense. Instead, we might say that the person can respond to their name, they understand the relationship to the examiner, they're aware of where they're located, and they know the date and the time. If we're using clinical terms, then we may have to define them. So, for example, affect, we may, in parentheses, write behavioral expression of emotion. So the reader understands affect. Again, when we go back to a past lecture that we've done together, affect and mood can often be mixed up. So sometimes if we just have a little description in parentheses, then our reader can understand what we're talking about and how we're differentiating. And again, where we can, make sure that we use specific examples. So instead of saying that the defendant behaved aggressively, instead we may use the specific example that the defendant threw his pen across the table whenever asked about his mother. Opinions. They need to be supported by data and relevant research in general, as well as the high stakes world of forensic psychology. So always back up your opinions. As mentioned earlier, if there is data that does not fit or is contradictory, we don't throw it out and we don't exclude it from the report. This is unethical. Instead, we need to discuss alternative hypotheses and where we can reject those through the use of data and research. We always want to explain our reasoning. That is going to be the connection between the data and the opinion. Lastly, we're going to talk about the structure of a typical report. You can think about it like a research paper. Start with the header information. That's going to be your information as the author and the information on the person you are evaluating. Next is the referral information. Why are you writing this report? Think about this as your introduction to your paper, which justifies your method section. Next, we move into the sources of data. So here we're going to list all the sources, and then we're going to dive into each source with their own paragraph. This might include, again, information from the clinical interview, collateral interviews, testing data, past records, etc. And you can think of all of these as our results section. And then next, we need to give our clinical formulation and opinion based on the legal question at hand. So think about this as the discussion section. We don't want to forget about the limitations as well. We will even put in a statement if additional information comes to light that we can add an addendum to our report. Lastly, we have a recommendation section, which is similar to the future directions section of a research paper. So hopefully this analogy of a research paper was helpful to you. So now we are going to move on to our next video, which is lecture part 2, and we are going to look at a sample report and break it down so you can really have a good understanding of how all of this that we've spoke about so far applies to a forensic report.